The Acting Secretary General of the KMPDU, Dr. Mwachonda Chibanzi, thank you so much for joining us this morning. We're still waiting for the Secretary General of the Kenya Red Cross, Dr. Asha Mohammed, to join us on how the country is preparing the medical or health workers that are dealing with this situation. And I want to begin with a question, Dr. Mwachonda. We've seen, of course, health workers. Yesterday, the Cabinet Secretary in charge of health spoke about the doctors and the health workers are properly and adequately prepared to handle this pandemic. Would you be as confident talking about your colleagues?
Thank you very much. So as a start is that, yes, health workers are prepared, but there are some bottlenecks that need to be resolved first. The first thing is that we are yet to achieve 100% training for all the health workers who are available. Mm-hmm. Second thing is that we are yet to have the protective equipment available to all health workers and in adequate numbers. And so given that we are not confident 100% to say that we are fully prepared. The other thing is that there are a number of issues that are yet to be addressed in terms of the care for the workers. We're looking at scenarios where health workers will get infected. We've already seen cases of mortality in other countries, like in Italy, where over 50 doctors have died. So those are questions that are coming from doctors and from the union, and we do believe that you're going to give a proposal on these issues that need to be addressed: compensation mechanisms, availability of PPEs fully, and how to achieve 100% training for the health workers.
Okay, 100% training. But one may ask, what exactly do you need to do to doctors to prepare them for this? Is it about talking about the disease itself? Is it in the kitting? What exactly would you be looking for?
Okay, so let's first start with the fact that doctors will be on the front line of this pandemic. So there are three things. One is the immediate work environment of the doctors. You need to have adequate equipment. We need to have adequate facilities in terms of cold rooms and holding rooms. Remember, these doctors will be on shifts, and they should be able to remain within that environment when they are seeing the patients and in between seeing the patients. The second thing is their support in terms of psychosocial support. We will need a good number of psychosocial centers, because this is going to be quite a big burden on the health workforce and the doctors most specifically. Then the third thing is availability of accommodation. Remember, and have you seen in other countries like in the UK, and in the UK, where hotels have been offered for healthcare workers and doctors who are seeing patients not to go back to their families, because they're already operating in a high-risk environment, and so that they need to protect their families also. In Spain, we've seen scenarios where nationalization of private facilities for accommodation and hospitals has been done in order to ensure that the workforce remains in the battlefield in the most fit manner in terms of assessment to work. Right. So yes, there have been efforts, and we laud those efforts, but there is still more that needs to be done with regard to ensure that the health workers and doctors are able to function when required.
All right, and Dr. maybe if you could benefit in terms of information, because when you talk about the countries like the ones you're referring to in Europe, Italy, Spain, and such, of course we know the load there is pretty high. The deaths there are very high. The cases that are critical or severe, they're also very high. So in Kenya, so far you have 42 confirmed cases. Out of those, it would appear one has died, 3 are sort of out of danger. But how would you assess the risk that your colleagues are exposed to currently? Are they just treating the symptoms, or have they gotten to the critical stage of managing, including the breathing challenges that the patients might suffer?
Okay. As it is currently, we have 42 cases. That is the figures that we have as of yesterday. And we do have colleagues who are already treating patients. And Nairobi being the epicenter, we have KNH, the KNH Infectious Disease Unit at Mbagathi. And there's already accommodation that has been provided for such when I talk of issues like accommodation for the doctors who are seeing those patients. Now, remember, a month ago, that is between 21st of February and 27th of February, Italy, Spain, Germany were at similar numbers that we are currently, of 42. So there's a disease, there's the progression in terms of the numbers. And so when we talk of such measures being put in place, we're already forecasting on where we're going. I mean, by mid-April, if you go by what is happening in other countries, and just even in South Africa here, we're already expecting high numbers by mid-April. And if you look at also the number of contacts that are being quarantined, contacts that are being traced that need to be tested, so we do expect more numbers. And if we're expecting more numbers, then we will get to the point that these other countries have gotten to. And so we need to be fully prepared by then. And that is why we are discussing as a union, and we will propose these proposals for preparedness for the health workers specifically. There's been very good efforts in terms of prevention, in terms of ensuring that the public is well sensitized. But for the health workers, the numbers are low. In fact, if anything, we need employment of more than 1,000 doctors. We saw yesterday that the statement from the minister that they'll employ 1,000 more health workers across all cadres. Well, for us, we feel that going by the forecasting, we will need more than the 1,000, and it's important that we budget for that. And the good thing is that the president was quite clear in his directive that funds, the 1 billion set aside for health workforce. Right. We, going by the numbers that we are anticipating, and given that the health workforce needs to be expanded, we still believe that there is space and there needs to be more efforts towards ensuring that we have funding, additional funding for the health workers.
All right. Of course, you're still trying to get in touch with Dr. Asha Mohammed, who is the Secretary General of the Kenya Red Cross. The Kenya Red Cross has been running a program to counsel doctors that are involved in this process of treating the COVID-19 patients. But Daktari, maybe you can help us understand, when these doctors, of course, they have been trained to deal with diseases and patients, but when the question of now having to deal with a new strain, the coronavirus still new, very, very contagious, as you've been seeing. What is going through their minds, and how is it like taking care of such patients from the stories you've heard from your colleagues?
The truth is that the pandemic is new. I mean, it's a new phenomenon right now, because the last time the world went through such a pandemic was in 1918, which is over 100 years ago, the Spanish flu. And so even experience from prior is not available, but experience from the colleagues is that as a doctor, you're trained to ensure that you put your patient first in terms of taking care of them and ensuring that they are treated. But at the same time, your safety also comes first. So the experience is that from the other doctors, it's been overwhelming, especially where they're dealing with large number of cases. It's been quite overwhelming. It's tiring. It has taken a toll on the doctors. But nevertheless, there has been support. And you see, one thing that has come out clear from the other countries is that this is a time for collaboration. This is a time to ensure that we all bring efforts towards ensuring that the frontline workers, the soldiers of this pandemic, for us it's a war, and so the soldiers need a lot of support. And so the community, the governments, the various organizations within our scope of the country need to support the health workers. In Germany, and in Germany, we've seen how they've had to bring in, they've supported Italy by taking care of the doctors from Italy. In Italy itself, in Spain, we've seen that they've had to nationalize their facilities around health workers, around the health facilities, the private facilities and accommodation facilities, so that the workers are taken care of. they have had to have more of support in terms of personnel that handle their day-to-day activities when they are taking care of these patients. So basically what we need is more of support for the workers.
Okay, and when you look at how they've been working, what are their shifts like? For how long do they have to be within those wards?
Yeah, so initially, I'll use the Italy example, and even France. Initially, when the cases were lower and had not hit the very high numbers we're seeing, and even in the US, they were working 12-hour shifts. But as time has gone, where they've been stretched, we've gotten to a point where, like in Italy right now, the doctors are doing 6-hour shifts and the nurses are doing 4-hour shifts. And remember, this is also affected in terms of, this is going to be affected, and it has already been affected when your colleagues, one, become infected and they have to move to quarantine. It means you have less number of your colleagues available to combat this.
Right.
Second is where you have doctors who have died, like in Italy, over 56 of them. So when they die, they're out. When they get infected, they're out. So we are also looking at a possibility of 30% of the workforce we currently have being infected and being out for a period of minimum 14 days.
Right.
So if that is what we're expecting, then we need very huge numbers. I mean, we've seen how now the US is calling out, is giving out visas to doctors who had applied probably for various examinations in the US to go and help out.
Okay, of course. Yes, Dr. Chibanzi Mwachonda, stay with us. We just want to listen to the Cabinet Secretary in charge of Health, that is Mutahi Kagwe. Yesterday spoke about the strain that hospitals are facing, and him talking about when you look at the situations in Europe and what is in the country, then there's a possibility that the health system will be strained in the coming days and weeks. Let's just listen to the Cabinet Secretary.
We know that going forward, it is indeed very likely that our health facilities can and could be overrun by just the demands. And this is why we are saying this is not a government issue alone. The protection of each individual's life, the protection against this disease is an individual responsibility as it is a community responsibility.
All right, that's the Cabinet Secretary talking about the possibility of us straining the facilities. But Daktari, even as the Cabinet Secretary talks about the community taking responsibility, when you look at the situations in the wards, what would be, I don't know whether you've managed to do that, but I'm sure you have through your colleagues, what would be your word to the society, despite the images that you're seeing, for instance, in Langas, of people saying that they're not going to go home because they need to continue fetching for their livelihood? What would be your message on how we need to take this pandemic?
The pandemic is affecting us all. That is from the workers to those in government and to the society and the community in general, the Kenyan society in general. So my message to the society is that what we are faced with is a very difficult time, but more importantly, let us adhere to the regulations that are being set. Let us also see ourselves being affected. I think part of the problem we have is that we think it's someone else who's going to be affected. The minute you start seeing that I can be affected, a close relative of mine can be affected, then you will take very good measures in trying to combat, into adhering the issues of, the guidelines of social distancing, washing your hands and your mouth, and ensuring that you minimize contact as much as possible, staying home where possible, and going out only when necessary. Yeah.